I want to ask our next two speakers to come join me on stage. KX Jin, the head of health at Facebook, and Amie Batson, the executive director of Women Lift Health at Stanford University. Come on up and join me here.
Thanks.
Thank you.
Thank you.
So there's a famous Mark Twain quote, which is something like predictions are hard, especially about the future. But it's hard to have like a tech and innovation conference where we don't think about the future. So we're going to get there in this event. But first, it is kind of a rare opportunity to have KX on stage. So I want to take a moment to hear a bit about what Facebook is doing in the health sector. For those who don't know, KX met Mark Zuckerberg, I think, on your first day of classes at Harvard, if I have that right. And you actually graduated, unlike Mr. Zuckerberg, which hopefully you needle him with once in a while. You were one of the early employees, and you were involved in some of the core elements of Facebook that we all know, newsfeed, advertising, groups. And you recently, as I understand it, chose to take on this role of leading health. So a pretty big thing for our community. I'd love to know, what does that mean? What is Facebook doing in health? What's your vision for it?
Great, thank you, and thank you for having me. Really excited to be here. So it really starts with the Facebook mission, which is to give people the power to build community and bring the world closer together. And I probably don't need to tell other people in this room this, but people have really always relied on others and their community for support around health, so whether that's caregivers, family, health workers, and so on. And with the rise of the internet and phones, more and more of this is happening online. And so I think for me personally, I just felt there was a real opportunity and actually just a responsibility to better support some of those needs. And that's what my current team, which is part of our broader social impact efforts, is focused on. So finding ways to help bring people and organizations together to improve health and well-being.
And maybe you can give us an example. I know it's early, but a sense of where this can actually have an impact in health.
Yeah, I'm going to give you a couple. So probably our most mature product is our blood donations tool. And this really came out of a need that we were seeing happen on our platform. So people were actually asking their friends and family for blood donations, and this is happening quite a bit, especially in markets where the blood supply is more on the replacement model, where the burden's actually on the individual to find donors. And at the same time, we were also seeing blood organizations using our tools like groups to organize donation drives and camps. And we thought we could work together with these people and organizations to better support those needs, and we ended up building a tool around blood donations, and it's actually pretty simple. So on one side, people can opt in to be registered as blood donors on Facebook, which just means that you'll get notified when there's a need locally. And then we also work really closely with blood organizations so that when there is a need nearby, we can notify the donors. And this product's been around for about 2.5 years now. Excited to say that at this point, over 60 million people worldwide have signed up to be donors, including over 40 million people in India alone, which is one of the first markets we launched a product to. And probably more excitingly, it's not just the numbers of people who have signed up to be donors, but we're seeing increasing evidence that this product is actually driving incremental and significant new donors to blood banks and really helping, and that's coming from the partners themselves.
Do you have a sense yet of the 60 million, how many have been able to actually donate at this point?
I think not specific numbers, but certainly from a blood bank perspective, we have many case studies where individual blood banks are able to like survey people and attribute people on the way in, and a very substantial percentage of those are coming from Facebook in some of these cases.
Gives you a sense of the scale of the platform.
Yeah, so that's one example. And then a more recent example is a lot of our work around coronavirus, COVID-19. And here I think there's a clear need for people, ultimately people want information and accurate information about what's going on. And so we're working really closely with organizations like the WHO, as well as a variety of local ministries of health to help them meet people where they are and searching. And so when people search for, say, coronavirus or related terms, we will show credible information at the top of those results and link to the WHO website, or to relevant other websites, as an example.
Yeah, getting that credible health information out is really key. So many more things I want to ask you, but I want to get Amie into the conversation. Amie, at the same time KX has been at Facebook, you've been spending a lot of your career on the other side of the fence, in a sense. You were at some of the major global health, global development organizations, including in a leading health role at USAID. You were chief strategy officer at PATH, the major NGO working in the health sector. So, as you look at some of what Facebook can bring, a platform of this scale, we're getting a sense of it, what do you see as the opportunity, and kind of put your hat on from the public sector side? What do you think the public sector ought to know, or how should they try to engage with the major tech companies of the world like a Facebook?
Yeah, it's incredible to hear about an example of just 2 years getting 60 million people. I mean, it just doesn't happen in our public health world. I think Peter was sort of saying we're very linear, and unfortunately, I think that's been the case. So I think there's some amazing opportunities for our community to learn from and build on some of these platforms that are reaching individuals where they are and can provide them with the best information, accurate information to inform their health-seeking behavior as well as their kind of individual behavior change. And so focusing on that demand side, which we've been so weak on, frankly, in the health sector. I think also on the supply side, I mean, the value of data, of being able to know where people are, know what's happening, be able to have all of this data kind of brought together and data sets combined to be informing decisions of where your health workers need to be, where your equipment, your medicines, your vaccines, has such opportunity for improving the efficiency and the quality of our health systems that it really is sort of a chance for a game changer, taking us out of the kind of vertical, siloed approaches that we've been fragmented into and starting to get into some space where we can really be reaching people where they are and making sure that the supply side of what we have is meeting the demand side of where people are and having a better health intervention.
So much of what we've been talking about today are partnerships. So with your hat on now, Kex, leading this initiative of health, how is Facebook planning to engage and interface with the USAIDs, the PATHs, the many other organizations that are here today, some of which may not understand, might be skeptical, there might be trust questions. How do you say, look, we've got this 2 billion person platform, here is how we can actually partner together?
Yeah, I think it's really important we work together, and it's partly why we're here today, right? I'd say what we're trying to do in our team as part of our broader social impact efforts, which have been around at the company for I think 4 or 5 years now, we're actually goaled fundamentally on the long-term social impact we can deliver. And I think there's a belief that if we do this well, this will be good for usage, because if we're building services that are useful for people, they'll
keep
them.
coming back, you'll get more users.
And it'll probably be good for our brand, but like actually the goal of the social impact team is purely on social impact. So the work on our blood donations team is actually goaled on, are we actually helping the blood banks build toward a sustainable supply of safe blood? And we try to actually measure and work with them to measure the incrementality we're delivering. In terms of how we pick what we do, this is something we're thinking a lot about. At a high level, we want to find things that Facebook is uniquely suited to do and where we can have a significant contribution. So unique in the sense of like if we didn't do it, it wouldn't happen, or like someone else can't do it better, right? And if someone else can do it better, they should do it. So that's what I mean by unique. Significant is like in the context of the actual health issue we're working on, the contribution needs to be meaningful. It can't be like 0.5%, right? And so we're trying to find things that hit both of those criteria, which generally mean they're very mission aligned to Facebook, right? When we're fundamentally about connecting people, building relationships, and so on. Where we really do need to learn is get input and around like, well, what are the health priorities, right? Like that's fundamentally not our area of expertise. That's actually the public sector's area of expertise. And so I think the real potential for collaboration here is taking that input and then working collaboratively together to figure out where are our unique strengths and for which of these issues can we work together to have a significant positive impact in the long run.
And so Amie, again, thinking back to your background here, what do you see as the opportunity? If you were talking to USAID, what should they be doing with Facebook? How should they access this chance to leverage the platform?
Well, I think what the maxim KS said of like, if someone can do it better, let them do it, is something we in the public health sector should take to heart, because we're often trying to do things that others are better suited to do. And so I think recognizing that some of these innovators and these firms that are investing billions with hundreds of thousands of top tech experts, we should be building on that, not trying to replace it, duplicate it, put our resources trying to do the same thing. So for us, I think the public sector has a real responsibility to be creating the space for them to be working, creating what are those priorities? Let's align the key partners around those. Let's create the guardrails that are critical to ensure that it is a quality, safe health intervention with the necessary privacy protection, with the right information in place. And a really important part of that is around the alignment of us, right? There's that saying of we've met the enemy and it is us. I think sometimes with the number of public sector partners working in fragmented ways, we really create a lot of transaction cost and a lot of confusion, so that when private sector partners look at what should they do, it's like, well, should I be listening to the malaria team over here or the HIV team there, or what the country is saying here, but no, a donor is financing it, not the country, so should I listen to the country or the donor? And it becomes very difficult to identify really what are the top priorities. So I think the value for the public sector partners, the funders, the governments, and then their NGO technical partners and the WHOs of the world to come together to define what are some of those top priorities? What are some of the required standards that we want to put out there to ensure kind of safety? That we can then help really leverage up some of these technologies and make sure that we're serving the people of the world.
Does that resonate with you, KX? What do you see as the big barriers to having the impact that you want to have as an organization?
So certainly, I think getting the input on what the global priorities are is incredibly helpful. I will say, like, with the partners and people we've worked with so far, I've actually found that to be pretty clarifying, and not having experienced a lot of that, but that is extremely important. I do think one of the challenges we see is take misinformation, which is something we've spent a lot of time, and I've spent a lot of time thinking and working on in the last year, is misinformation really thrives when there's a void or absence of accurate information or trusted information. And fundamentally, like every parent, I'm a parent, I have 2 kids, like they want what's best for their kids, right? And they're seeking out that information online, offline, and so on. And I think there's a lot of, like, we clearly need to do, and we have work to do on removing and reducing harmful information, but just as importantly, we need to help, like, get people access to credible information and from trusted sources, right, in the moments that they're seeking it out. And that's something that I think we really need to do in close partnership with the public sector, because again, like, we're not the people who have that information. That actually really shouldn't be us, but we need to work closely to connect people in that way. And so I think that's like a really, really like top of mind thing for me.
Just not to interrupt, but I've got a little story in my book about something called condom water. I don't know if you've heard this before, but apparently in Colombia, this is going back several years, a rumor spread on Facebook among high school students that if you boiled condoms, prophylactics, in water and drank it like a tea, this would prevent pregnancy. And a local NGO that works using algorithms and machine learning on the Facebook platform in Colombia, they were able to find this and then get out there with credible information to try to counteract it before you had a really significant problem. Apparently it did. This is what the NGO claims, that it did work. But as you say, there's 2 sides of this coin. There's a misinformation problem, and then there's the getting the accurate information out there.
Yeah, there's a couple other examples in the vaccine space that I found pretty interesting out of, I think, Denmark and Ireland, where both countries had pretty severe declines in HPV vaccination rates over a period of 4 or 5 years. But then over the last few years, they've actually started to recover, in some cases pretty dramatically. And so it's like, what happened, right? And I think a lot of it was actually a cross-sector coming together, parents, health workers, government, and really like creating an advocacy campaign to tell the story of like why this vaccine is effective and safe, and like meeting parents across media, that's both online and offline, and it's very effective. And I think that's an example of like something that we can learn from and hopefully apply to other areas.
And vaccine hesitancy is a big one, certainly in this community, a real challenge that we've got to take seriously.
Yeah, and the WHO has been very clear about that as one of 10 threats they identified in 2019. Right?
So I cut you off before, but I want to move to the next thing, unless you've got a final point you want to make. With the limited time left, I do want to start thinking about the future a little bit. And you both have interesting vantage points from which to think about that future. So, a lot of what we think about when we think of the future today is pretty negative. I mean, there's a lot of threats and challenges out there. Vaccine hesitancy is one. Climate, we just talked about earlier. what do you see as the potential, stitching together the many people that are in this room, the many elements of the global health community, which has now grown and expanded to include private equity investors and technology companies? What does that future look like if you had your ability to see that vision come to fruition? What do you think, KX?
Me first?
Yeah, sure.
Is it like, what, 10-year horizon?
Yeah, think about 10 years from now. Where could we go? What's possible?
Yeah. This is hard to predict. I was actually thinking a little about this. Just like, think about 10 years back, right? It's like 2009, 2010. I mean, I think the most crazy part is like 2010, 2009, most people in this room wouldn't even have a smartphone, right? And so it's actually kind of crazy how quickly technology changes. So I'll try to answer this in two parts. One is like maybe a little bit specific to health, and another is more about technology. So I think on health, one of the things I'm very excited about is working together to fully unlock the value of this current tech platform, which is really mobile phones, for good, right? And I think to do that, and you've probably heard a lot of this today, we're going to actually have to work together, online and offline, to build trust and relationships across all of the people that care about this, from people, caregivers, health workers, the public sector. And I think we actually all have a lot of the same goals. So I think it's possible. And I think one of the powers of technology is this type of ability to make it easier to connect. And I think we should work together on how to bend that toward the arc for good. And I think that applies to a broad set of issues, right? Like we have this like horizontal vertical thing, right? This is kind of a horizontal thing, but you know, it's important for blood donations, where fundamentally you're connecting people and organizations in the blood banks, right? Blood donations also, I think, really just shows the tremendous capacity that people have for good and generosity, right? Donating blood is fundamentally an altruistic thing, and it's pretty amazing that this many people are willing to do it when presented with the right opportunity and the right information. So, but it also applies for vaccines or a whole other thing. So I think that's kind of like the first thing that I'd love to realize over the next 10 years. We're able to realize this at scale, and with the associated causal impact measurement, so we can really understand what's working and what's not. On tech platforms themselves, I mean, this is really hard to predict. If you'd asked me 10 years ago, like I probably would not have actually predicted the explosion in mobile phones, and I'd say like that's a big part of the reason why 2012, 2013 were incredibly difficult times for anyone working at Facebook, because we were actually just so late to the shift to mobile. A couple trends I am excited about. The first is VR, so not AR, but VR. For those of you who haven't tried out the Quest, I'd really encourage you to try it, not because it's an Oculus product, but it's something that I think is like starting to capture the potential of VR, and there's a lot of like gaming going on, but I think just like this potential to really help connect people, have that feeling of presence, is going to actually be much broader than just gaming. And
people are going to live in a more virtual reality world.
So I think, I mean, like, you know, we have vastly distributed teams. A lot of like communication and coordination is now distributed. You have, you know, VC, right, which is a big step up from a phone call. I do think there's a lot of applications there in the VR zone where that can actually make the communication even more real. A lot of applications in health too. So that's one kind of new platform that's emerging that I actually expect will land before AR, or if you're talking about like, you know, glasses for AR and so on. And the other one's just like more AR voice assistance, kind of ear type augmentation. I think that's also going to be pretty big. But like I said, I actually think we haven't yet fully harnessed the positive potential of the current platforms, mobile phones, and that's something I'm very excited to work on.
Amie, your thoughts, again, 10-year time horizon.
Well, from the non-tech perspective, but for implications,
yeah.
I think it means we're going to be able, health will be actually coming to the level of the individual, that people will be able to get access to good information to inform themselves. Hundreds of millions of people will now have access that don't have access right now. And I think that that's going to be a tremendous game changer of creating demand and creating smarter consumers. I think that I'm looking, in 10 years, I think countries will have built up their knowledge and expertise with then the voice to be building their own kind of digital and implementing their own digital strategies around their priorities. And that a large part of that will then start to be moving away from the very siloed one disease, one intervention at a time, which is often, frankly, more donor-driven. And that gets driven by some of these platforms to be more like, how do I use this communication tool with so many people across everything I want that individual to know? How do I start using a technology that's informing my logistics across all of my different products that I'm using at any one time, not just my vaccines or just my malaria medicines? And so that we start to have those kind of cross-cutting platforms that are really driving efficiency. And I'd say the last thing is just looking at the different partners. I could see in 10 years where we built up enough experience, enough trust, enough sense of the extraordinary value that we now have kind of that alignment together, so that the investors, the country decision makers, and the innovators are all kind of sharing the same information, starting to share some of the same priorities of what is needed to serve our world, and that we start to have a more sustainable marketplace here, where we're finding ways to make sure we're driving down the costs of serving this world for the private sector, at the same time as they're helping ensure that these products are affordable through sort of innovative mechanisms like tiered pricing or the marginal pricing and whatnot, so that everyone is starting to be able to kind of go forward in a more sustainable way.
It seems to me like getting some things right now will be pretty critical to the vision that the two of you have painted, things like privacy, data ownership, things like the roles that these organizations play. You use the word alignment, you use the word trust. If those things don't happen now, you may never get 10 years from now to the vision that the two of you are painting. I wonder if either of you have a reaction to that as we close the discussion.
Yeah, no, absolutely. I think trust and relationships between us and the public sector and the people we work with, incredibly important. I'd say even just in the last year, that's gotten better, right? And it just takes time. You have to work together. You have to learn each other's language, and you have to just honestly work through some difficult issues together. And we're definitely still learning and still really early, but it's been really interesting to reflect on some of the work we did with some of the organizations I mentioned around vaccines last year, and how I think that has helped really us be more effective at working together around COVID-19 this year, and I'm really hoping to take some of those learnings and apply them going forward.
100% agreement. I think it's it's the step-by-step build. Trust doesn't come overnight. Yeah. Trust comes through experience and through people kind of saying we're going to do something and then following through, and both sides recognizing the value and both sides taking it forward. And I think that that's something we're seeing happen. We've heard a lot of examples in this room. Starting to see things like using the WHO information sources around vaccines and coronavirus and stuff. That kind of creates the trust in the public sector side that then they go the next step. And for Facebook, they start to see that, yes, we stuck by what our priorities were. We provided the content that was necessary. That creates trust on the other side. And gradually, we can continue to build on that and do more things that are more complex, that are maybe a little more risky, and kind of get out to that future that we envisioned.
Well, it sounds like 10 years from now, you might be reading Devex with your Oculus goggles on, but we will be covering this 10 years from now. Please join me in thanking KX and Amie for this great discussion.
Thank you. Thank you.